Welcome back, everybody, to Geigenomics. Today, we're going to talk about the COVID passports and how it relates to big tech and medicine. The medicine industry is one of the largest industries, if not the largest industry, in the United States economy. It is the largest supplier of jobs and will be the largest supplier of jobs for years to come. Now, what has happened with big tech is a collusion with government, and in the business of censorship and censoring people, big tech has been able to kind of co-op this situation of implementing its technology with health monitoring in the system of COVID passports. Now, what the COVID passport essentially is a digital paper that allows you to travel to not just other countries, but I think it's travel within your own domestic country, going to sporting events, concerts. There was an article about buying clothing stores. So I mean, down to the most minute business, uh, there's discussion of implementing a COVID passport. Um, and the way we have to look at this is always from the theoretical perspective. What does this look like in theory? Um, well, you have to understand that historically, where there has been the asking of a paper as a permission slip, um, this has been a reduction of freedoms. So, for example, in the 1800s, you've had freed slaves having to carry around their papers. In the 1900s, you had uh, Jews during the Holocaust having to have certain papers. This type of system of society that, upon request, has to show papers to a authoritarian regime is one that is simply not free. As a free individual, you have the freedom to, um, I don't want to say, travel into anywhere you want, but travel without being restricted. Um, in the sense, well, maybe not. I'm not sure about traveling in the theoretical sense of the word, um, in a free society with no states, but still with borders in the sense of walls and and property. But that's besides the point. The point I'm trying to make is that when you look at a society like China that is not a democracy, they have this Chinese social credit score. And what the COVID passport looks like is something similar to this, where you essentially establish a caste system of vaccinated and non-vaccinated people. And um, this is a digression, but there's a great talk. If you look up Yuri Maltsev, Yuri Maltsev, discuss socialized medicine. It was a talk delivered at the Mises Institute. He begins this talk by discussing these um, s- discussing how what Stalin, what people like Lenin, Hitler, Dewey, Bernie Sanders have in common is one hero, and that hero is Rudolf Ludwig Karl Virchow. And this man is the father of socialized medicine. And he said that medicine is a social science, and politics is nothing more than medicine on a grand scale. And people need to be treated for mental diseases, and that not many people know this, but the best student of Rudolf Virchow was Adolf Hitler. The first policy he implemented was one of nationalizing science. And what happened was I mean, yeah, it was yeah. So and not many people also know that the number one target of socialists is medicine, and Yuri points this out. This is all in his talk. He says that, even the philosopher John Locke asked the question, "Who owns you? Are you a free man?" And the socialists know that if they have the power of medicine over people, then they own you. And what this does when you have socialized medicine is it turns people into slaves, into public slaves. And when it comes to medicine, again, with the theoretical perspective, in order to observe it, you have to look at it, and from the economic lens, medicine is a normal good. The more money you have, the more you demand of it, and also with the increase in technologies, this has led to new innovations, new equipment, new types of surgeries, hip replacement, knee replacement, bypass surgery, all these different surgeries. So that raises the cost, but over time, with deflationary forces such as new equipment, do a surgery quicker, this drives the prices down. But with the currency we use and the Federal Reserve increasing the money supply, this lowers the value of the individual monetary unit, so this drives prices up. So you have the multitude of factors working in the healthcare industry, also with the partially socialized healthcare that we have, with the window of single payer healthcare. This drives prices up. Same with the universities. All the loans provided by the government allows the universities to charge higher prices. So that's another digression. But the point I'm trying to make is that when it comes to medicine and who makes the decision for you to get the treatment that you want? Is it you, or is it the provider of the health insurance? And if it's the provider of the health insurance, and if that becomes the state, then people are no longer regarded as assets to insurance companies and healthcare providers, because people are not paying directly for it. They're not paying directly for the service. So when they are the payers of the service, this term multi-payer, then there's an incentive for the healthcare providers and insurance agencies to provide the best quality insurance or care at the cheapest possible price in the competitive market. Now, when it comes to the single payer system, you have the effects of longer wait times, and people are no longer regarded as assets. They are regarded as liabilities. So you look at the Soviet Union, long wait times, people dying, doctors being paid 1/3 the salary of bus drivers. And what this means is that, in my opinion, the socialists know that medicine is the number one target to achieving their goals. What better way than to establish it through the cattle herding system of a COVID passport? I think that it could be a way to implement socialized medicine, at least here in the United States, is you have the collusion of big tech containing the data of your personal health information stored into the passport itself, and so that any group or I'm not sure exactly what the technicalities of it, but it's accessible to not just anyone who can see, did you get your shot? Did you get your meds? But I mean, people can deem you, or the state can deem you, not healthy, or a doctor not legitimate in prescribing something, or I mean, this comes back to the power dynamic, divide and conquer, create, you know, people willing to listen to the state authorities and people who are not so compliant. And I think that the COVID passports, if nothing made sense up till now, are very dangerous to a society that was once built off the principles of freedom. And I think we can do better. Thank you.